Welcome to the Pelvis Party, a health talk show in partnership with Olmsted Medical Center, where experts and guests dive into real conversations about hormones, sexual and pelvic health, and everything in between. We're creating a space for honest, judgment free talk. There are no dumb questions, no awkward topics, and definitely no shame.
Hi, everybody. Welcome back to Pelvis Party. My name is Becky Monpetit. I'm the owner of Rochester Local, and today I am joined by the two other co-hosts for Pelvis Party, Britt Marshall from Olmsted Medical Center. She's with Marketing Communications, and this is Dr. Melissa Richards. She is the Division Chair of Hospital and Surgical Services at Olmsted Medical Center. So today we're talking about C-sections.
C-sections, cesarean sections.
Caesarean sections. Okay, who's had one?
I've had 0 vaginal bypass surgeries.
I like that.
Is that nice?
Yeah, it is nice. Actually, I like it.
Mm-hmm.
I've had 2.
Yes.
Yep, 2 at Olmsted Medical Center. Arguably, why we're all sitting here today, actually.
Yeah.
Because my journey with Olmsted Medical Center started with my care at the birth center, which started conversations about starting up a site for women and moms in Rochester, la 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 la. And here we are.
So a cesarean section did all of that.
Yes. This is why
Wow.
we're sitting here today. So I think, arguably, a lot of people know what a C-section is. I think we know it's a vaginal bypass surgery. I've never heard that term before,
It's
so I
great.
really like that.
Yeah.
And I think that we know that it is an alternative path to deliver a baby out of a person.
Yep.
But I don't think that many people know some things that can happen, or I just don't think that there are a lot of things that are talked about like, during the actual procedure or after the actual procedure that are just simply not talked about. Right?
Right.
So we want to talk about some of these. Okay, so I'm going to put you on the spot.
Oh, I love this. Yes.
In your opinion, what are some things that people who are going into a C-section are not expecting?
Right. So it's interesting because we kind of have like 3 different cesarean sections of it. We have like a scheduled cesarean section where patients know that they're going to be having a cesarean section. We have unscheduled, but we've been talking about it and for one reason or another. And then there are the urgent. So that's something right there. Like there are kind of 3 3 different types of cesarean sections that we have at OMC. Okay. So like my scheduled cesarean section patient, we're talking about that. And why would we do a scheduled cesarean section? It's because the baby is not head down. So the baby's breech, and we don't do vaginal breech deliveries of singleton babies at OMC.
Yeah.
So that patient's going to get a much more counseling at each visit than someone who's having an unscheduled or a stat C-section. So right there, people don't know about something really simple that we take for granted, especially when it's an unscheduled or a stat C-section or scheduled, that just because you've had one cesarean section, that doesn't mean now you are signed up for cesarean sections forever.
Yeah. Oh,
that is a very common misconception.
Yeah.
Now we do vaginal births after cesarean sections, trial of labor after cesarean sections.
Oftentimes referred to as a VBAC.
Or TOLAC. So
TOLAC.
Right? So the TOLAC is the labor portion.
Yeah.
And the VBAC is the outcome.
Yes.
So when we have patients who've had previous cesarean sections who want to have a vaginal delivery, they are consenting for a trial of labor after cesarean section, and the outcome is the VBAC.
Okay, yes.
Just so we've got all that.
That's true.
Yes.
Yep.
Yeah, it's kind of confusing.
What does VBAC mean?
Vaginal birth after
C-section.
C-section.
Okay.
Right. So that is if you
succeed in doing that.
Succeed. I don't even like the word.
Yeah.
But like VBAC, that's if you have your baby via your vagina. You have had
the
a
outcome.
VBAC.
Yes.
Yes.
Absolutely. And so like at OMC, we have a very high success rate with vaginal birth after cesarean sections. We sit around anywhere between 70 to 80% of our patients who make that decision to do a trial of labor are successful.
Yeah.
There are certain things that make you a better candidate.
Yeah.
So we make sure that people are well informed about there's risks when we try to have a vaginal delivery after a cesarean section, and we take those risks versus the benefits.
Yeah.
So that's the one thing, is knowing you can have a vaginal birth after a cesarean section. It sounds kind of goofy, but hospitalization time. So patients are like, so how long do I stay in the hospital? Typically, patients, your insurance will cover 3 midnights after the
Yes.
cesarean section. But a lot of our patients actually go home after 2 midnights,
Yeah.
as long as they're meeting criteria, meaning they're walking and peeing and
Yeah.
passing gas, and they're ready to go.
Yeah.
Nobody's getting kicked out the door.
Right.
But a lot of our patients are going home the second day, post-op day 2, after
Yeah.
2 midnights. At OMC, we also, like, medication-wise, that's different. So, like, after a vaginal delivery, typically ibuprofen and Tylenol can get you through, and a lot of times sitting in the tub, a vaginal delivery. But after a cesarean section, I'm intentionally hurting you, causing harm to deliver your child. And what cracks me up is, like, any other surgery that involves an incision that's about 10 to 15 centimeters in length on your lower belly, we would be like waiting on you hand and foot. We'd be like,
and foot.
right?
Don't move. Let me reposition you. And when you have a C-section, they're like, time to get up and walk.
Breastfeed, do all this stuff. Pee.
Let me push on your belly.
Also, you've got all this bleeding coming out of your vagina. I mean, come on.
Right.
So, like, pain management is very important. We want to make sure people are getting what they need.
Yes.
So we actually have this really cool program at OMC called Meds to Beds.
Yeah.
So you get your Tylenol. We use Toradol as opposed to ibuprofen, which is kind of like a fancy ibuprofen.
Yes.
And then Tylenol, Toradol, and a narcotic, typically oxycodone. Once again, we've intentionally hurt you.
Yes.
So a limited amount of a narcotic that you can use, and a stool softener.
Yeah.
That's something we got to talk about too, is your bowel, just having a baby in general. And then add cesarean section, a major surgery into the mix. Yes, that's.
And if you are taking the narcotic, it
it's like you're like the narcotic helps to alleviate the pain, but it also plugs you right up. So you got to take those two in tandem.
Absolutely.
Right. Well, as a graduate of the School of C-Section, a double grad, thank you, I have a few things to add.
Yes, please. This is exciting.
Right?
Patient perspective.
Well, my first was obviously an unplanned C-section. However, little Muffin was 12 days past her due date. And I've been having all my, stress tests and whatever. And I go in, walk into the birth center because they're like, time's up. And I was administered a dose of Cervidil. And boy, oh boy, did that not jumpstart things.
Okay.
I was like 0 to 8. And like,
which is kind of fascinating. As a side note, Cervidil usually is just like, oh, I'm a little crampy.
No. I mean, we were like, it was like, I was 0 everything. 0 dilation, 0 effacement, zeros across the board. She was just in there funny. And I ordered a pizza. And by the time the pizza got there, I was like, whoo, mom's got to go in the tub. And I got out of the tub and like walked to my bed, and my water broke all over the floor.
Oh, wow.
Yeah, I know. And then, it was very crazy. And then basically she just stalled because she was in there funny. And I called for my epidural, got my epidural. And then from there, it was just like, I'm going to use my term, a nothing burger for like 12 hours. No,
oh my gosh.
nothing. No, what is it called? Progress. Then in comes the Pitocin. Finally get me to a 10, and I pushed for 3.5 hours. And my midwife, Pat Hink, who was there for quite some time, leaves the room, and I look at Age, I'm like, this is not good. She comes back in, and she was teary, and I'm like, oh. I go, I know what you're going to say. She's like, yeah. So to the room we go, right? I know, this time. So I cried, and then here we go, right? So I think there's a couple of things that really surprised me about having a C-section.
Who came to the room, though? So Pat came in.
And then my laboring nurse, which was Deb Weinrich, who's still there.
Deb's awesome.
Love her. So it was Deb who stayed with me the whole time, who actually stayed with me through going in, through her shift into the operating room, came with me. Pat was there, which I was not expecting, by the way. I did not know that your midwife came with you,
Yep.
can go with you into the operating room. So it was the anesthesiologist, and it was Dr. McKeon who was there. Bless her, wonderful.
Yes.
And it was a team of wonderful people in the operating room. And that was around 12, whatever, and Evie was born at 1:41 in the morning. So, what I did not expect is a couple of things post C-section. Now, this happened for both my daughter and my son, who was born 18 months later. They have to push
Oh yeah.
in order to get the baby out. It's not like you just slice.
No. That's a real medical technical term.
Slice. They don't just make the incision and then pull that baby right out. It's not like a tube of toothpaste, right? Well, actually, it kind of is.
Yeah, if
They
you're pushing.
push.
So you can't see what's happening. So what's typically happening is I have made my incision. That's
Not a slice.
Not a slice. I've made my incision. I've gone through the layers. I've gotten to the uterus, and I'm making my hysterotomy. That's the fancy word for the incision on the uterus. And then my assistant will say, "You're going to feel some pressure."
Yes.
And then they're using a hand to push at the top of the uterus to help kind of bring the head up.
Yes.
Because I need help. I can't just, I have baby's head or whatever is right there in the pelvis.
Right.
I need help. So I'm not just, applying gentle.
Yanking.
Yes, exactly. I need that additional help. But yeah, it's impressive and you don't expect it.
No, the pressure was the most painful. Not the most painful. There's no pain involved. It is just
impressive.
It is a sensation.
Yeah.
And it was so unexpected for me because I was not prepared for it. And that was the part for me that was that got me the most worked up. And I'm like, can this please end? Because it lasted for quite some time. And for me, that was the part of recovery that was painful. Is not this incision, but this kind of trauma or bruising or discomfort that came because she was up there. When another thing that was really unexpected for me is that when you are stitched up and dressed up and then taken back to your room, which is the same room or whatever, we can talk a little bit more about that too. When I'm recovering, I had tremendous pain in my shoulders.
Shoulder pain.
And what the nurses told me is that was gas pain from trapped air.
So it's really interesting. So you have your phrenic nerve that is part of your diaphragm, but it also works for sensation in our shoulders.
Yeah.
So when you have air or even a little bit of blood from after the cesarean section, it irritates the phrenic nerve underneath your diaphragm.
Yeah.
And you feel it in your shoulder. The same thing happened to me when I had a laparoscopy. And for some people, it's more. Some people don't even have that. Some of the tricks to help with that shoulder pain is kind of moving, because you're trying to move whatever's irritating underneath your diaphragm to help your shoulder. It's weird.
It really, really hurt. I was unprepared for that. The last thing that I was truly unprepared for when it came to a C-section is the bleeding. I did not know that when you had a C-section, you also experience post-delivery bleeding just like a vaginal birth. And so when it happened in the bed, I was like, excuse me, nurse.
Yes.
And I did not know. I had no idea.
And isn't that wild? Because when you think about it, it makes complete sense. The placenta is attached to the uterus in both the patient who has a cesarean section and vaginal delivery. And that bleeding is the site where the placenta has now left the uterus, and where it was previously attached. That area needs to heal. And that area, part of that pain that you're having probably too is that uterus contracting, because that uterus is contracting. So that area where the placenta was attached, those blood vessels heal and retract in so you don't bleed to death.
Yes.
But the bleeding is completely normal. Typically, we'll hear from patients that the bleeding's lighter after a cesarean section than a vaginal delivery, but there still absolutely is bleeding.
I mean, and I wouldn't have known that because I've never experienced a vaginal delivery, but I just didn't expect any bleeding whatsoever. And I kind of felt dumb for not understanding or realizing that. But if you don't know, you don't know.
Right? like just in general, it would be interesting if we all had a really honest conversation. Like, why do we have bleeding after we have a vaginal delivery or a cesarean section? I bet a fair amount of my patients, due to me making assumptions and them not thinking to even ask, we just assume, oh, it just happens. I don't know
Right.
why it happens, but it happens. Be
Right.
great, as a point of conversation, like, oh, it's the placenta coming off the uterus. It's the blood vessels that were attached to the placenta that are now
Yes.
retracting, and that's why we have bleeding.
Right.
Do you
Right.
also deliver the placenta
Mhm.
after
Mhm.
like a regular vaginal delivery, or you take it out of the
That's a great
stomach area?
question. You take it
Because
out
I've
the
never
same
had
ti-
one,
I
so I
know,
don't
this is
know.
great.
Yeah.
This is awesome. So yeah, after the baby is delivered, then we typically do try to do, this is new since you delivered, 1 minute of delayed cord clamping. As
Yes.
long as you're doing well and the baby's doing well, we'll have the baby kind of up on chest.
Yep.
We'll show the baby, oh, look at the cute
Yeah.
baby, this is amazing. As long as baby's doing well and mom is doing well, we wait 1 minute, then we'll clamp the cord
Yeah.
times 2, and then and cut, and then the baby will go over to the warmer, and then we'll deliver the placenta.
Yeah. I
Mhm.
think that was, when did you start doing that?
Well, routinely, like some people would do it here and there,
Mhm.
but routinely in the last couple of years.
Yeah, I think Teddy, I thought Teddy's 7, so I don't
Mhm.
know if that was,
Mhm.
but Teddy was born in distress,
Mhm.
and so he needed positive
Yep.
pressure,
Mhm.
PPV.
Which is also, that's something that's
Yeah.
very common that
Yeah.
we forget to talk about, is transient tachypnea of the newborn with cesarean section.
Yeah.
We see that's fancy for like this troubles breathing when you're born. You're not
Yeah.
getting that same squeeze that you get going through
Yes.
the birth canal or the pelvis. So we expect that.
Yeah.
That's something to expect. So that's also something
Yeah.
we try to remember when we're consenting a patient for a cesarean
Yeah.
section, that we know that's
Yeah.
baby might need a little extra help
Probably the
transitioning.
scariest moment of my life
Mhm.
was when he came out, and he probably needed, I don't know, a good 90 seconds,
Mhm.
2 minutes.
Yep.
There was no crying, and
Right?
they were,
Yep.
come on, buddy, come on,
Yep.
buddy.
Mhm.
That
Yep.
probably feels like
And
forever.
yeah, and
when you're
then
just waiting.
his blood sugar was low, so he had to be whisked off to the
Mhm.
nursery.
No.
So I didn't see him for about 4 or 5 hours, maybe.
Mhm.
So lots of things
Mhm.
to be mindful of when you're
Mhm.
having a C-section. However, outside of all of those things, my experience at OMC was like outstanding, like
Mhm.
start to finish. And the things to know is that your experience as a C-section patient, as opposed to a vaginal birth patient, are not differentiated.
Mhm.
You experience the same care and the
Mhm.
same dignity.
Mhm.
Yes, you are delivering your child differently, and yes, the emotions around that can leave a parent feeling really conflicted
Mhm.
for expectations versus reality.
Mhm.
However, I feel like the staff and the providers at OMC are so well in tuned to understanding that a patient may be feeling this way,
Mhm.
that they are going above and
Mhm.
beyond to accommodate for
Mhm.
that.
Yep.
So just, down to experiences and rooms and what's available. And so that's what I loved about my experiences at OMC. And it's even been a few years. So yeah. Um,
Yeah.
that and stay your 3 midnights. If you can have your 3 midnights, stay your 3 midnights.
Absolutely.
Right? I mean,
If you want to, you can.
I
If
mean,
you don't, like,
that's my personal
you're the
thought.
boss, man.
I know you're the boss, but also stay 3 minutes. And stay on top of your pain meds.
Right?
The day after, you're going to feel like you're on top of the world, and you are going to do laps around the birth center, which I did both times. Even though the second time I'm like, don't do laps, you're going to really regret it. And I totally regretted it.
Y-
Adrenaline
Yep. That's the tricky part.
and oxy.
Listen to your body.
And you're
And-
like, absolutely, I'm doing laps.
Right.
And then the next day, you're like, why did I do laps?
Mhm.
Anyways, thank you for talking about C-sections with me. Obviously,
Absolutely.
a topic that I like to talk
Yeah,
about.
it's
but
great. It's awesome.
if you are interested in learning more about topics that we talk about on Pelvis Party, please go to rochesterlocal.com/pelvis party. Thanks so much for joining us.
Thank you.
Thank you.
Thanks for tuning in to the Pelvis Party. As we always say, there are no dumb questions, and this is a safe place to ask them. So please drop us a line, let us know what's on your mind for a future episode. And as always, like and follow for more.